Welcome to the Pharmacy Innovators podcast. I'm your host, Jim Jorgenson, and today it's my pleasure to connect with two of my friends and team members and longtime pharmacy leaders, Phil Brummond and Steve Rao. Welcome, guys.
Thanks, Jim.
Yeah, I know most of our audience is probably familiar with your work, but for those that might not be, can you give us a little bit of your history and how you got to where you are today? And let's go Phil first, then Steve.
Sounds good. Well, something I'm pretty proud of. Born and raised in Minnesota. Grew up in southern Minnesota, did my pharmacy school education at the University of Minnesota. Jim, I think you spent a little bit of time there back in the day.
Way back in the
day. Following my time there, I joined the team at the University of Wisconsin, did a PGY 1 and 2 along with my master's degree residency. And then had the fortunate opportunity to join the leadership team out at the University of Michigan when Jim Stevenson's there, John Clark, and a number of others. Spent about 5 years in a variety of different leadership roles there before having the fortunate opportunity to come back to Wisconsin into Milwaukee as director of pharmacy at Froedtert Hospital. And as Froedtert was evolving into Froedtert the Medical College and expanding, had an opportunity 5 years later to step into the chief pharmacy officer role, as well as started an organization called Froedtert Health Pharmacy Solutions, which was our go-to-market strategy related to specialty, infusion, and PBM services into the marketplace up here in Milwaukee. So still live just outside of Milwaukee. Still a Vikings fan, one of the very few that's out there, and excited to be here today.
Thanks, Phil.
Phil being from Minnesota, he and I have a lifelong border battle going on. I'm originally from Wisconsin, originally from Green Bay, and I've lived in Madison for most of my life and my career. I completed administrative residency training and my master's degree at the University of Wisconsin in Madison back in 1994. So I'd like to say I'm a PGY 30 in resident years, learning something new every day. I had enjoyed a 20-year career at UW Health here in Madison, where 17 of those years I served as the pharmacy executive for the UW Health system, focused on advancing pharmacy services at UW, spent a lot of time and was very passionate about developing the next generation of leaders for the profession, and also serving the profession in a variety of volunteer capacities with pharmacy professional organizations, locally with PSW, nationally with the ASHP, Visante, and the University Health System Consortium. And I really believe that the more you give, the more you share, the more you get. And so spent a lot of time working with good friends and colleagues, collectively trying to assure each other's mutual success and advance the profession. In May of 2020, I transitioned into a role with Visante, and since that time, we assembled a team, a very talented team of professionals that partner with hospitals and health systems around the country to advance their success by strengthening their investment in pharmacy and striving to partner with hospitals and health systems to maximize the value they receive through their investment in pharmacy. And so just last month, February 1st, I transitioned to my current role, which is CEO at Visante.
Thanks, Steve. It's been great for me. I mean, I've admired your work for years and what you did at Froedtert and University of Wisconsin, and to have the opportunity to be on the same team with you guys for the last 3.5, 4 years has been tremendous. So really appreciate that. One of the most fun things I think that Visante does each year is our top 10 list, where we try and highlight the top 10 issues that, pharmacists should be prepared for in the coming year. And I'd like to focus our conversation on the 2024 top 10. So first, maybe can you guys add a little more color on why you do the top 10 list and how you go about figuring out what goes on the list?
Sure, I can start with that, Jim. I think pretty simply, it's about giving back. It's about helping pharmacy executives, helping pharmacy leaders who are our colleagues be successful. At Visante, we are in over 130 hospitals and health systems annually, striving to advance their pharmacy programs. And through that experience, we get to see pharmacy leaders face a lot of challenges, both internal and external. Most all of our team members have walked in the shoes of current pharmacy leaders, so we know just how daunting those challenges can be to face as a leader, and how challenging they can be to overcome. And in addition to seeing challenges, we see a lot of innovation, we see a lot of successes and a lot of breakthroughs. So as we learn throughout the year what the top challenges and successes our leaders are facing and enjoying across the country, our goal is to share what we see, what we've learned in a concise manner to help pharmacy leaders, I think, number one, understand the contemporary issues their peers are facing. Secondly, appreciate that they're not alone. Sometimes misery loves company, but you're not alone. We're all facing the same challenges, and the priorities that you're facing locally as a leader, others are facing across the country. I think that's good to know. And thirdly, and probably most importantly, we strive to have the top 10 help leaders succinctly advocate for resources, innovative strategies head on with confidence and success, so they can be successful at the local level, driving change and making healthcare better through pharmacies. So we think that we know through our experience that with great challenge comes great opportunity. And we know that these days organizations that have a clear vision and strategy for high performing pharmacy always seem to be the ones that find the exciting opportunities and end up being successful. So this year, we always put a pretty positive glance on this. And I'd like to say that this year we see more opportunity in pharmacy in the future ahead than we've ever seen before. Phil, I don't know if there's anything you have to add to that.
Yeah, I just think it's hard to come up with just 10. So as we talk with our colleagues around the country and what's going on, what they're facing, our goal is to get to 10. Sometimes being pharmacists, we can easily get to 20 or 30 of some of the most important things that are going on. And obviously around the country, within hospitals and health systems, there's hundreds of priorities. So oftentimes we also go out and just ask a few people, give a little pressure test of, are these some of the things that are resonating with you as well? It's not done in necessarily a major formal way, but it is a way for us to make sure we are hitting what are believed some of the top priorities as we enter 2024 that will have longevity and, if focused on, can create value not only from patient care, quality, and outcomes, but also financial success.
And Phil, I just add that I think it's a process, right? It's something we take seriously,
Yep.
Producing the top 10 and sharing it in writing and in this format with our peers. So it's something we put a lot of effort in. We engage our team in, and we spend a lot of time, the last quarter of each year thinking about what are those top issues for the next year. So it's something that I think brings joy to us as we get to see the impact we're making as we write about the top 10 issues facing our peers.
Excellent. So let's dig into just a few of the topics on the list. And maybe the first one, Phil, you alluded to in your introduction. I think, an obvious item that made last year's list and this year's list is the continued emergence of specialty and infusion pharmacy. And obviously those two topics are closely aligned, as many specialty drugs are infused. So what are you guys seeing in terms of overall trends in these market spaces?
I think, from my vantage point on this, we're seeing tremendous growth. If you look at what's going to happen over the next 5 to 10 years regarding therapies, not just oral take-home and or injectable therapies, but also infused therapies, for rare diseases, orphan status, all of those things, this is top priority. So when you look at the infrastructure that's been built within hospitals and health systems related to specialty pharmacy, I think some of the large systems have definitely put focus on this over the past 10 years and has actually allowed them to care for their patients. From an infusion perspective, I think it's been much more challenging, just based on what's going on related to site of care, related to just capacity in general. So many of the folks we work with around the country are struggling with capacity, some of which don't have complete picture of what their capacity is and how they're meeting or not meeting their needs of their patients that they're servicing. And the other thing that I think is very interesting in this space is you're seeing, obviously, for-profits, vertically integrated organizations and health systems alike really racing to determine who's going to be the trusted advisor of the patient. And as you look at what that means, obviously from a COVID perspective coming through and what consumerism in healthcare is evolving to today, people want choice, they want convenience, they want flexibility, and they want to know what they're going to pay for the services. And our health system today really struggles with that. And so on the specialty side, both specialty take home and specialty infusion, there is obviously a renewed emphasis to make sure from a health system perspective that you're in the ability to care for your patients, especially as you move from a fee-for-service model to a value-based and or fixed fee type of a model. Steve?
I think I agree with all of that. I think, you know, specialty pharmacy and infusion, we call it infusion strategy, but it's really being more innovative with retaining infusion business outside of the traditional hospital-based environment. There are many formidable competitors out there facing that come to compete with hospitals and health systems for those patients, and there's a lot of pressure on from outside payers to move that business external and to make that care more convenient. So when you look at opportunity for pharmacy leaders to differentiate the value of pharmacy to achieve the goals of the organization, I still think these are probably the top two areas. Fortunately, they're growth areas. There's not a lot of areas where you can drive new revenue into the organization, but both of these specialty and infusion areas, you can still continue to do that. And it's not just about money. It's about quality care, patient convenience, keeping care internal, freeing up doctors and nurses if you do pharmacy well in these areas, helping them spend more time with patients. So just all sorts of different levers that can be pulled to drive value as you grow your internal programs and not rely on external entities to come in and take the business. I think, you know, on the specialty side, we've seen the majority of large hospitals and health systems have developed specialty pharmacies, but usually when we come in, we still find, you know, while they've had success over the past 5 to 7 years, there's still a lot of opportunity to continue to grow through investing in resources, centralizing medication access programs. We'll talk about efficiency later, expanding into consolidated services. On the infusion front, I think infusion is where specialty was 7 years ago. So we still find that most pharmacy leaders understand they need to do something to retain that business and to be entrepreneurial, but they don't all have as clear a vision around exactly what it is that they need to do. So, you know, we enjoy getting to work with pharmacy leaders to help cast that vision and then help them collaborate better with managed care, with revenue cycle, to develop the momentum in the organization to establish new sites of care, to compete with the payer restrictions. So it's really a fun area to be involved in.
Yeah,
I
I
know-
think,
No,
go ahead. Me?
Yeah, go ahead, Phil.
Perfect. I do think, you know, Steve, what you highlighted is really around that coordination. So when you look at, you know, infusion sites, specialty infusion, as well as even take home, you know, injectables and things like that, that coordination and approach to caring for patients is pretty complicated. And so as I've spent time, even today, having calls with 2 CEOs today on infusion strategy, the issue is just comprehending the different nuances when it comes to HOPD infusions, to pharmacy-based infusions, infusion suites, home infusion, physician-based infusion, and just that coordination of when one, you know, enters or puts an infusion order in the system, who chooses where it goes? Who's involved in the decision-making process when it comes to restrictions, access, service, location of patient for convenience? And most systems today, oh, and the other important thing, are you going to get paid for it, whatever that location is? But most organizations, they really struggle with just the coordination in general. So as people are thinking about infrastructure, it's really going to be important to also think about what human capital infrastructure, technology infrastructure, other things are in place to be able to provide that coordination effort, which is going to be so important to making sure things are convenient for patients.
And so I think, you know, we see most health systems with strong specialty pharmacy programs, they've got the prior auth, the medication access piece figured out for specialty take-home drugs. Maybe they've got medication assistance carved in there, but very few leverage that centralized pharmacy workforce to do infusion, medical benefit, prior authorization benefits investigations. So the referral process is usually very decentralized in most organizations. And we have not been in an organization yet when we look at going and spend time with clinic nurses and determine where the business is actually going. the referrals outside of the system are always much greater than what anyone in the organization originally believed. And then what we work to do is to work with the finance team of that organization to build the business case around, if you invest these resources in pharmacy, a little bit of capital, not too much, some additional FTE, what that means in terms of financial value for the organization, what it means for patients and their better quality care, for providers and for nurses, for their ability to care for patients better. So it really is the next frontier in helping have well-coordinated, integrated specialty pharmacy and infusion pharmacy workforces within the pharmacy team that service the patient holistically is where we see the future going. And we've had a great success over the past couple of years working with clients to understand and invest in that strategy.
Steve, I want to pick up on something you said earlier about most large organizations, having these services up and running. But, I often hear smaller to mid-sized hospitals voice the opinion that they just aren't big enough to get into these services. So what do you think about that? What's your experience with this?
I think you're absolutely right, Jim. They either think they're not big enough or they've been convinced by other consultants that are enjoying that business or want to enjoy that business that the barriers to entry are too great, right? And honestly, we see that to be false. We think if you're anywhere between 100 and 300 bed hospital and you're affiliated with physician specialists or even cardiologists or pulmonologists or endocrinologists and they're affiliated with your organization, there's always opportunity to capture and to grow a specialty pharmacy business. And you don't have to have a huge, 20,000 square foot facility with the best conveyor, robotics, et cetera. You can start it in a small community-based outpatient pharmacy, grow it, and as you grow it, document financial success, and then invest in the coming years in a greater facility. So I think your point is right on. There's a lot of opportunity if you're a small to mid-sized hospital to start and grow a good, successful specialty pharmacy program. It's great for patients. It's great for the organization. It's great for providers. And you can't talk yourself out of it. You need to work to talk yourself into it. We do have a lot of clients in that space and have seen great success working with smaller hospitals as well as the large hospitals. And I think the same probably goes for infusion, Phil, wouldn't you say?
Yeah, and I think when it comes to, oftentimes we think about things in size. So it's the size of the hospital, number of beds, those things. When it comes to specialty and infusion, it's less about the number of beds, acute care beds, as it's about the mix of both providers and patients and the types of patients and providers that you have. And Steve, you highlighted some of that as well. And so many of the small community-based or medium-sized community-based regional medical centers have those providers embedded in the system. And so I think it's important when anyone's taking a look to say, should we invest in something like a specialty pharmacy or infusion service, or look to partner with somebody to help accomplish those goals? It's important to understand that mix.
And the other thing we find, when I was at UW Health, I worked a lot with larger hospitals across the country. In my career at Visante, I've had the opportunity to work with a lot of new pharmacy leaders that I had never met before in somewhat smaller organizations. And we have got so much talent in our profession that I didn't know existed before I came to Visante. It's been great getting to know those leaders. And, most of them are predominantly from the acute care environment. So when you work with them and partner with them as we do, we're able to help them build confidence and competence in helping to grow out their ambulatory specialty pharmacy and infusion and footprint. So it really is great opportunity in a lot of those organizations.
Yeah, Steve, you mentioned efficiency, and I think as organizations struggle with labor shortages and rising supply costs, the need to become more efficient operationally was highlighted in the top 10. And I want to dig in a little bit deeper into two of the suggested areas for pharmacy to consider. And the first one is centralized services. And both of you led multi-hospital pharmacy programs supported by Pharmacy Central Service Centers. So what are you guys working on in this area to help other organizations with this concept?
And I can happy to take a stab at that. And when you talk about efficiency, it can be good or it can be bad. And centralized services is one that is entirely good because it's about really creating two things. One is the space for growth for 15 to 20 years in the future. We all know that obtaining space in hospitals and health systems is competitive. It's political. And consolidated centralized services can be built in lower rent districts that maybe are a little bit distant from the hospitals, so you don't have that competition. So number one, it's about growth. But number two, it's about systemness. We've seen multi-hospital systems form nationally, but many of them still behave and operate in silos and don't work together as a coordinated system. And if you achieve systemness in pharmacy through a consolidated service center, you operate more effectively, more efficiently, you achieve economies of scale, you have opportunities to lower your drug spend, to standardize, to avoid waste, to reduce redundancy, and really have better quality pharmacy services and become an employer of choice. We currently are engaged with 8 systems, multi-hospital systems across the country, in various aspects of designing their financial performance and the roadmap. So helping with the cost justification. Once you get the CSC cost justified, helping with the design, and then once the design and the build out is done, working to implement and optimize CSC services. And we have not seen an organization yet where we haven't been able to come up with a hard dollar positive financial return on investment that's achieved within a 3 to 5 year time frame after you get the capital dollars to build the CSC. That doesn't just have a positive ROI, but it also sets the system up for many, many years of growth and improved efficiency and effectiveness as a pharmacy program. So the growth areas we see with CSC always center around specialty pharmacy, infusion, and other entrepreneurial opportunities in the ambulatory environment. On the cost saving side, we find and implement opportunities to leverage expanded space and technology to drive lower drug spend and to manage that drug better, to lower your unit costs of medications and to distribute them effectively across the system. Culturally, we find when as pharmacy organizations are successful and they grow, you can improve the culture by having the pharmacy leaders work together in a space that's not just innovative and entrepreneurial, but really a high-performing workspace. And then on the efficiency side, great opportunities for logistics, expanding packaging operations, sterile compounding operations, really making sure drugs are procured, managed, distributed, and utilized efficiently and consistently across the system to drive better quality through pharmacy service. So it's about growing revenue, it's about lowering costs, it's about streamlining your workflows, and it's about being the best work environment within health system pharmacy for the future.
Steve, to add in a little bit, I think when you look at consolidated service center operations, obviously there's a framework or a footprint of space that brings systemness together. We oftentimes see organizations can actually start achieving that systemness around function and form, even prior to even going into a consolidated service center. And I think, when you look at large organizations, so this is one where probably not the small hospitals and medium-sized hospitals are thinking, these large footprints to be able to, operationalize, drug distribution and services across the system. Some systems, 50, 80, 100 hospitals, but we still see 3, 5, 7 hospitals finding the justification for a consolidated service center that allows them to grow and scale in that area. But I do think there are things that can be done even prior to a consolidated service center. And obviously we're working with clients all around the country to be able to do that, especially as, mergers and acquisitions of new facilities coming on board, and how do you integrate those things in? Most organizations have some standard set of P&T, formulated decision-making, maybe some more successful than others. But in general, there are so many different services that can be centralized without taking, some of the autonomy out of the sites that are going to allow you to drive value from an efficiency, quality, safety, and financial back to the individual entities.
Phil, I think, your point about getting started right away is really important. There's two things I see pharmacists, and they might sometimes be true, but like knee-jerk reaction a lot of times out of not just pharmacy leaders, but all leaders is, well, we could do that if we had more people, or we could do that if we had more space. And I think in general, we strive to not message it that way when we work with clients. Like, there is tremendous upside, and the CSC is going to take a couple of years to get a shovel in the ground, get it built, get it designed and built and optimized, right? So you got a 18 to 24 month window from the time approval happens to when the CSC opens. There are a whole bunch of things you can do in parallel during that CSC design and build out phase to drive value, to use your larger hospitals to service the smaller hospitals more efficiently, grow and expand the entrepreneurial services in the space you have. So it's all about messaging in a positive way and finding that early value and committing to that as a leader. Once you get the dollars, then when you establish those values year 1 and 2, when that CSC opens year 3 of your business case, you're just on a much higher trajectory for success in the future.
And I just think inevitably when you're designing and coming together around building a consolidated service, then you're talking about workflows. And those workflows are differing across the whole system. And so having those conversations around what we are doing in one location, the other, to be able to share best practices and then come up with a workflow that's going to work for everybody, obviously drives towards systemness.
Yeah.
I don't think you need a building to do that, but the building process definitely guides you down that pathway. But there are also organizations that if you're not looking at a building tomorrow or a consolidated service center, there's things that can be done to drive standardization, which ultimately drives efficiency.
I think a second element that invariably pops up when organizations start talking about efficiency improvements is benchmarking and analytics. And I know you both had some extensive experience with pharmacy benchmarking and analytics. So, what should we be thinking about here?
Benchmarking has been the gift that keeps on giving in my career in pharmacy, right? The only way you get good at benchmarking is by having it be used against you, it seems. And unfortunately, there's still a negativity around it. There doesn't have to be, but there is. That in healthcare, benchmarking is still used. It's used by big consultants. We're seeing a resurgence of this, but to primarily find ways to reduce FTE and to improve staffing efficiency. We all know there's other ways benchmarking can be used to drive better quality, better value, but that's not always consistent with the labor-related goals that benchmarking systems are used for. So I think, while there is a resurgence in benchmarking around labor, I would say as a pharmacy leader, you must stay proactive, right? If your organization's using external benchmarking, don't badmouth it. Say, all right, I'm gonna raise my hand. I'm gonna learn more about it. I'm gonna try to manage it effectively the way it's intended to be used, so that the organization gets the expectations from its investment in the benchmarking software. So you always got to know your peers, who they are. You got to select them wisely. Know what metrics you look good in, what metrics you underperform in, and have genuine effort to try to improve your performance on a broad base of metrics or KPIs, some related to labor, some related to drug costs, and some related to overall pharmacy drug plus labor spend together, and thinking more innovatively about pharmacy metrics, not just related to cost. Because if you want to look better on cost, there's only one way to go, and that's down. So think about metrics where you can go up and to the right on in terms of quality metrics, safety metrics, revenue and margin growth metrics. And then once you understand and you're a leader that has credibility, that when you get resources, you view them as something you need to manage effectively. Once you get good at that, you get some analysts in your pharmacy program, you can develop good metrics over time. So ultimately, the best recommendation is to rely more on your internal productivity metrics than your external, because you can compare yourself against yourself with time and show that you're improving your performance. So as a pharmacy leader, I would insist that every area that reports up to me has metrics that they're going to routinely measure over time, each month, and track and present to you in a way you can present up the ladder within the organization that shows the value that's being achieved in the organization as a result of their investment in each area of the pharmacy department. So think about, how do you demonstrate value? How do you have a variety of metrics? How do you insist that all your leaders and your staff understand what those metrics are and contribute to them? And lastly, I think keep thinking about skill mix. There's a lot of, one of our top 10 articles this year and last year was on workforce. And I don't think we'll talk about this today, but the pharmacy technician workforce is a highly valued workforce. It's hard to get, but there's a huge difference still between technician costs and pharmacist costs. So think about leveraging technicians as far as you can, so that your pharmacist time is spent closer to patients and on activities that really demonstrate value for the organization.
Yeah, and I can't stress enough, the internal benchmarking is critically important. So looking at, not just labor side or worked hour per unit of service, but, measuring quality, safety, outcomes. not widgets, but those aspects are really important because over time, you ultimately can get to top decile performance on almost any benchmarking software tool if you have it set up right, if you're forcing yourself to continue to gain efficiencies or improvement up and to the right from a financial perspective when managing against yourself. So as long as you stay consistent in that way, it's an 18, 24-month journey. You will drive productivity and efficiency in that manner.
And Phil, one of the things I think you and I have both learned throughout our careers is stories work better than widgets. So have good stories to tell about how pharmacists save lives, about how they help the organization achieve its goals. And, you know, there's a lot of organizations that they want to protect their frontline clinical pharmacists from worrying about that. And I think you got to tip that the other direction. I think you got to ask your pharmacists for help and show them that if they're able to deliver for you more stories to tell about the value they provide, that you're going to be more successful in advocating for their ideas to be successful and getting them the resources they need to expand their patient care services in the future.
Yeah, I think, Phil, that outcomes piece is so important because to really get an accurate picture, you need volume indicators, efficiency indicators, and outcome indicators. And so often we see the first two, but they're light on the third. And without those outcomes, you really don't have an accurate picture of what's happening. I think that's really important. You know, another topic that I think that's getting a lot of attention is pharmacy revenue cycle. And you know, with all the emphasis on cost reduction, I think pharmacy's impact as a revenue center often gets overlooked. And two areas that you guys noted for pharmacy revenue cycle in 2024 were engaging pharmacy and managed care contracting and deploying a multidisciplinary pharmacy revenue cycle team. So tell us a little bit more about what you were thinking with these initiatives.
But, you know, I think we could probably spend a whole hour just on this topic. And obviously we've got some deep experts on the Visante team that definitely can get into the weeds on it. From my perspective, when I'm looking at, you know, revenue cycle, pharmacy revenue cycle, if you're looking and you're spending that much money on drugs, you should be looking to make sure you're getting revenue from that, or at least the charges and all those things are going in correctly, and you're all of that's working right. What I've seen based on my experience personally, as well as working with others around the country, the revenue cycle processes are oftentimes very fragmented. And when you talk about what a fragmented process in this area, there's folks that understand deep expertise, likely in different teams spread around the hospital and health system within finance or managed care, maybe some in pharmacy. And oftentimes, the left hand doesn't know what the right hand is doing. There's assumptions that get made. And even when it comes down to, for instance, managed care and what that partnership looks like, if a pharmacy leader has no idea what type of contracts that the organization has related to infused therapies, and they're building things in Epic to go one way or the other, and all these other things, those aspects are likely not matching up appropriately. And we see write-offs. And those write-offs can be very, very large. So when you look around core centerness from a pharmacy revenue cycle related to teamwork, collaboration, what we find at Visante is we work with many teams to bring them together to essentially create the nexus of understanding of what the pharmacy plays the role and how pharmacy plays a role within revenue cycle, how the revenue cycle team plays a role, finance team, managed care team, and usually bringing that group together, outlining processes, responsibilities, and accountabilities, and then putting measurements and process in place to manage that. Organizations can be quite successful.
You know, there's an old adage, if you don't know what you're being paid, you're likely leaving money on the table. And I think we see that a lot when we work with clients on revenue cycle. We are in a relationship business, right? Healthcare leaders must have successful relationships with peers, not in pharmacy, but outside of pharmacy to be successful. So, and by we say relationship, we don't mean like you walk down the hall and you're civil to each other. What we really mean is, like Phil said, on the front end, pharmacy being a partner with managed care contracting at the table, understanding the organization's contracts, how pharmacy can position itself to get better payment and or negotiate better contracts as you expand from the acute care into the ambulatory environment. On working closely with revenue cycle on the front end of the rev cycle around prior authorization services, and are they coordinated? And on the back end, when denials happen, do you have pharmacy team members that are experts and collaborate with revenue cycle leaders to understand when denials happen, why they happen? How can you mitigate those so they don't become write-offs? And how can you implement preventive strategies so that write-offs don't and denials don't continue to happen in the future? And then there's that middle piece with the medication bill within the electronic medical record. And lately we've seen more and more pharmacy departments. A lot of them don't have the resources in pharmacy, they're in IT. And over the course of time, sometimes the focus on what you need to do to build those medication EMRs to maximize reimbursement and avoid write-offs fades off, right? So I think the opportunity in rev cycle is about really collaborating with managed care contracting, with your IT team, and with your revenue cycle team, and having it be a team approach with the right resources, continuously working together to drive improvements. So great area of opportunity. If the more removed pharmacy is baseline from partnering with rev cycle and managed care and IT, the greater the opportunity is. It's not unusual to have 5 to 7% of an organization's infusion net revenues being written off when we come in and look at that data and we find the organization had no clue that was happening before the engagement. So it really is a great opportunity. I think an area we're going to see more pharmacy expertise needed and an opportunity to quickly drive value for the organization. And you can also, when you find that value, you can back bill 12 months oftentimes as well. So it's not just a forward looking, it can be a backward looking way to quickly bring in large sum of dollars to the organization's bottom line quickly.
Last, an intriguing topic on this year's list that you guys wrote about is the concept of grit for pharmacy leaders. So where were you guys going with this one?
Yeah, I can start with that, and then Phil, you can add your thoughts. Grit is the only, Phil and I kind of had fun with this one, coming up with the idea and writing about it. It's the only non-pharmacy topic in the top 10 this year. And I don't think it's unique to pharmacy. I think it's something we see amongst all healthcare leaders needing to have to assure future success, given all the headwinds, all the competing priorities, and all the challenges they're facing. And I think, there's misconceptions about the word grit. First of all, some people might think grit means you're willing to work harder. And we think grit isn't about how hard you work. It's about, how much you can take. How hard can you get hit and keep coming back and moving forward in a way that's positive in the face of challenges. So I think pharmacy leaders, to be successful, they need to have grit. What does that mean? They need to constantly be a source of new ideas, be growth minded. What's good they need to be patient centric, and they need to be business centric and thinking about driving revenue. Grit means you have to have tenacity. You can't fake caring. So without getting, people notice that pretty quickly. So you got to care a lot. Be tenacious about caring about your people, about your patients, about the success of your organization. And despite headwinds and challenges, when you're the leader, you must have perpetual optimism. Things are always good. You got to have a vision that you can clearly and succinctly articulate. You got to spend a lot of time communicating that vision verbally with your teams. Spend a lot of time saying thank you, catching people doing things well. And sometimes it means you have to, if there's conflict, you got to take it on in a way that's graceful. You need to be willing to have difficult conversations, which I still think are probably one of the biggest deficits in a lot of pharmacy leaders is when things don't go well, you avoid the conversation. And if you have grit, it means you're going to make sure you take it on and have try to have a win-win outcome whenever there's challenges and differences of opinion. So it's a challenging world right now, becoming comfortable with ambiguity. And I think as a leader, if you demonstrate grit, you insist on accountability. You insist upon yourself being accountable. You insist upon your team being accountable and always being prepared and positive about the future and the opportunities in front of you. So we think it's a skill that people need to be thinking about. Are they displaying grit? And it doesn't just mean you work hard. It means you work smart and you're positive.
So I think I taught you a few things, Steve.
And I'm always learning, as I said, PGY 30.
Yeah, I don't really know that I have much else to add, but as one of the things I really love about my role and job here at Visante is I get a chance to talk with a lot of people around the country and have conversations and connect and develop relationships. In the process of doing so, I was trying to put my finger on what was it this past year and what's necessary and needed next year when it comes to pushing through. Because, as Steve alluded to, there are headwinds. I think some of the most challenging headwinds are just the number of competing priorities. And it's, it's difficult sometimes to waver through that. And many of the folks I talk to around the country, and those I don't, are very passionate about caring for patients, very passionate about making sure that the care that's being provided for the patients that their teams and frontline caregivers within pharmacy are providing is of top notch. And that is not an easy thing to accomplish when you've got the headwinds of financial challenges, when you have competing priorities, when you've got expansion of what's going on within the healthcare systems today, of adding new sites, new practices, new physician, groups coming into the mix. And then you got vertical integration going on, just a small thing happening in outside of the health system. So, I do believe in Steve, you articulated extremely well. Grit is an area that I think, if you go home at night and you're like, what I need to come back with harder tomorrow, it's just a little bit more grit to get through that day. That ultimately, when you look at the long run, will allow you to achieve the goals that you're looking to achieve.
And Phil, one of my mentors taught me that, no one ever achieves in a year what they think they should. But if you're determined and positive over 5 years, you'll always achieve more than you ever thought you could have. And I think that's true today. So the leaders that demonstrate grit 5 years from now are going to have a much, much better career, better future, more successes, more relationships, and just be a lot happier and successful. So the opportunities are greater than they've ever been before. Times are challenging, but the light at the end of the tunnel is very, very bright. And I can tell you the success doesn't happen by accident. And being in those 130 organizations we're in, the ones that are most successful always have a strong leader at the helm. Without strong leadership, success in pharmacy can't happen. So we need our leaders to display grit, to be positive, and to share that uplifting future with their teams. And we see just great things for the profession, and we look forward to partnering and working with those who are hopefully listening to help take pharmacy new places over the next several years in the future.
Well, this has certainly been a great discussion. And I think, as Phil said, we could keep going for hours here, but wrapping up, Phil and Steve, thanks very much. And I look forward to seeing how your predictions do for 2024. And thanks everyone for listening to this edition of the Pharmacy Innovators podcast.